Oh, sorry. I hope that what I'm going to share will be relevant to you, knowing that you do a lot of counseling as ministers. So I will be touching on a number of issues. It's actually just four things. One, I'm going to talk about the challenges of doing counseling under lockdown and the risks that are involved in doing that, the benefits that I've identified, and then lastly, I will deal with the common psychological problems that people are presenting with during the lockdown. So I think I can switch off the video now. All right. So I'm a clinical psychologist based in Pretoria. I mostly do counseling and some forensic work where I a number of criminal cases that need psychological assistance. So I have been in private practice in Pretoria for some time. I started working in correctional services where I did a lot of counseling with offenders. So I will be drawing from some of those experiences today. I will appreciate if you can prepare questions while I'm presenting this, so that we can have a discussion after this. Okay. So let's start with the challenges that are involved in doing counseling under lockdown. Lockdown has forced us as counselors to make use of online counseling. Because we know the risks that are involved in doing physical contact sessions, but also the restrictions are making it difficult for us to see patients face to face. So, one of the challenges of doing online psychotherapy is the fact that it's a bit difficult to build rapport because you don't really have access to the body language of the patient. You know, it's you rely more on the facial expression and what they're telling you, and you will know that part of counseling it's being able to look at the body language, because there's quite a lot of information that we get from just observing the body language. So with online counseling, you don't have that privilege. And the other challenge that I've come across is the internet disruptions, especially when we're having the load shedding. Sometimes also depending on where your patient is, because we know there are parts of our country where network it's quite a challenge, you know. So that is another issue, because what it does is that it affects the flow of the session. So you miss certain things that the patient is saying, and there are certain things that the patient is missing from your side because of the internet disruptions, and sometimes you have to repeat yourself, sometimes you have to seek clarity. So that makes the counseling session quite challenging, and it affects the building of the rapport with the client as well as the flow of the session. The other challenge that I've come across is professionalism. You know, people think that because we're doing counseling on, it's not a professional context. So you will have people wanting to talk to you while they're in their pajamas, while they're in their night dresses. Some of them want, I mean, I had a patient last week, 2 weeks ago, who wanted to have counseling while he was in a shebeen. You know, his friends were dancing in the background, and he said, no, we can talk. I'll be able to hear you. But there's a lot of distractions, obviously. So people struggle to maintain, you know, professional boundaries when you do an online session. Like I said, in terms of the way they dress, because if the client is not dressed appropriately, that can be a distraction to you as a counselor. So it's important to discuss professionalism with patients before you see them for the session. And the other challenge that I've come across as a counselor during these times, it's emotional fatigue. You know, I go to the office and I see, you know, patients, let's say 8 people, and they telling me about loss, bereavement, stress due to COVID, due to restrictions, and lately, obviously, due to the protest and the violence in our country. And I come home, I watch TV, it's the same things that I've been hearing the whole day. So you as a counselor, you have to find a way of protecting yourself and ensuring that you take care of yourself, because as a counselor you don't deal with good news. People don't come to a counselor because they have something positive to say. It's all bad news. And you can imagine if you spend 80% of your time hearing these painful stories, the stories of loss, stories of depression, stories of suicide, and you get home and you open your television, it's stories of people who were killed, the number of people who died from COVID. So that can affect you emotionally and psychologically. So as a counselor you need to be aware of that. But that's one of the challenges that I've had to learn to deal with. Now, the online psychotherapy or online counseling has a number of risks. And the first one is safety. You need to think about the safety of the patient, because typically your patient will be inside their room alone while they're talking to you because they want privacy and they don't want to be disrupted. But now, let me just give an example of a patient who has a history of epilepsy. We know that with epilepsy, sometimes when they discuss emotional issues, that can trigger epilepsy or epileptic fits for them. And now, how do you deal with that? Because you are in your office, you are having counseling session with this person who's in their room at home, and they're having fits. How do you assist them? Because you are not physically there to hold them and to do the basics that one needs to do. So you need to be aware of that. People with history of hypertension, history of sugar diabetes, when they discuss emotional issues, sometimes that can trigger those chronic illnesses. And sometimes you can have a patient collapsing in the session. Now, how do you deal with that when you are doing the counseling online? So we need to think about that. And I will give some practical things that one can do. The first thing that you need to do before you can confirm an appointment to do counseling online is you need to do a history check, to say, do you have any history of epilepsy? Do you have any medical condition that can render you unconscious, that can lead to fits, that can lead to you collapsing in the session? Do you have history of traumatic brain injury? So you need to check if there's anything that can make it difficult for them or that can put them in danger while they're engaging in therapeutic discussions. The second thing that you need to do, you need to get contacts of one person or two people who are close to the patient. So for example, if I'm seeing someone in Mpumalanga and I'm in Pretoria, the first thing I will say to the client is, can you give me contacts of someone close to you, the neighbor, your sister, your husband, but someone that I can call should anything happen to you while we're having the session. And then the third thing, you need to get physical address, so that should anything happen to them while they're in a session, should, let's say, for example, you suspect that their safety is threatened, which police station are you going to call? Or should anything physical happen to them, which ambulance are you going to call, and how are you going to provide the physical location of the patient? So it's important to get that information before you can start the session. But safety is a big issue when it comes to online counseling. The second risk is confidentiality. Where we know that Zoom, Microsoft Teams, all these platforms that we are using, they can be hacked. I was not aware of that until I think about a month ago, when a very high profile person was referred to me for counseling, and I said to her, look, because of the nature of your work, let's do online counseling so that you don't have to worry about traffic. And almost, with a lot of these people, they don't want people to see that they're attending sessions with a psychologist because it can be in the media. So I recommended this, but the person was advised by their security that Zoom and Microsoft Teams are not the safest platforms in terms of sharing confidential information. So you need to be aware of that. You need to know about that. And I know that there are private platforms that can be created specifically for you, and that is quite expensive, but that is something that one needs to consider for the safety, but also for the privacy of your patient. The third thing is the physical impact of the screens. We know that being on the screen for some time can damage your eyes, and it also has some neurological impact in terms of how your brain functions. So it's important to reduce the amount of time you spend doing counseling. So I limit my sessions to 1 hour. And if they push it maybe to 1 hour 30 minutes, but you need to avoid being on the screen for too long as the counselor, but also avoid putting your patients on screen for too long, because that will have impact in terms of their physical health. So those are the three risks that I have identified from my experience of doing counseling online. Now, what are the benefits of doing counseling under lockdown and doing counseling on online platforms? The first benefit is convenience. A lot of patients prefer these platforms because, one, you don't have to worry about traffic. You don't have to worry about distance. You don't have to worry about the amount of time you spend on the road. So you can just be in the comfort of your home, connect with your counselor, and have the session, and you just go to bed after that. So the convenience that comes with online counseling is great, and I'm enjoying it as well as the counselor, because I mean, sometimes I don't have to go to the office. I can just see patients online, and it's easier. The other thing, obviously, is the other benefit. It's you are protecting yourself from contacting COVID. It's safer in that sense. But the third benefit, which I think it's something that most people are not aware of, is that online counseling is as effective as the physical contact counseling. I've treated patients with depression who were suicidal. I've treated patients who had anxiety, who could not go out, who could not go to work, with post-traumatic stress disorder, with a number of psychological conditions online, and I saw the same results that I normally see in physical contact. So in actual fact, I prefer to do online counseling as opposed to physical contact. I find it more effective in actual fact than the physical contact sessions. I don't know why, but for some reason I just see more positive results from the online counseling as opposed to the physical contact. So much so that most counselors have opted to take their practices online, and that's because the differences are not that much in terms of online and physical contact. So I will highly recommend that we take advantage of this opportunity. We embrace technology, and we find ways of enjoying this kind of opportunities. What I like about online is that distance is no longer a problem. So if you have church members who have maybe traveled for holidays, they are in KZN, you are in Pretoria, you are in Joburg, and they need counseling urgently, distance is not a problem. You can just easily connect, and you give them the services that they require. So I will highly recommend that we learn how to use this thing and how to do therapy online. Now, let's go into the common psychological problems that are presented, during this lockdown period. I think the biggest one has been anxiety. People are anxious. We have different types of anxiety, but the one that I'm seeing lately, it's more general anxiety disorder. So with general anxiety disorder, the person is anxious, but they are not sure what it is that they are anxious about, as opposed to phobias, where a person will have a phobia of heights, or a phobia of darkness, or a phobia of snakes. You know that this person is scared of snakes. But with general anxiety, you're just scared, but you don't know what it is that you're afraid of. You are constantly worried, even when everything is fine, but you just can't get out of the habit of worrying about issues. There's this sense that something bad is going to happen to me. Something bad is going to happen to me. I'm going to lose someone. I'm going to lose my job. There's this constant worry and an underlying feeling of pending danger that people are struggling with, and then I think it's triggered by the fact that our sense of safety in the world as human beings is been threatened. Our brains have learned that we're not as safe as we thought, and anything can happen to anyone at any time. When you see people that you respected, people that we see on TV, our heroes, our celebrities dying from COVID-19, what the message that it sends to you subconsciously is that anything bad can happen to me. So you just become generally anxious, and I've been dealing a lot with that in counseling. The second most common presenting problem in counseling during these times is depression. People are depressed, and some of the most common symptoms of depression is the person is mostly sad, your mood is mostly low, you're finding it difficult to be happy. When you wake up in the morning, you're not looking forward to the day. You avoid contact with people, you don't want to talk to people, you don't want to be with people, you just feel like being alone most of the time. Sometimes when it's severe, you have suicidal thoughts where you wish you were dead, or where you feel like your life is just worthless, where you constantly have negative thoughts about yourself. Those are some of the common symptoms of depression. Your libido is low, your interest when it comes to sex is low, your appetite for food, you either eat less than you normally do or you eat more than you normally do. So that those are some of the symptoms that the person could be dealing with depression. And I've been seeing a lot of that in our office, where I mean, from children as young as 4 years old, they're feeling depressed. Their mood is low, and it's very difficult because we're living in very difficult times. The other thing that is quite common in our sessions, or in our practice, is bereavement overload. Now, bereavement overload is what we experience when we've had multiple losses in our lives, because there's been a pattern where people lose more than one person in the family. You lose both your parents at the same time, and you are mourning your mom and your dad at the same time, and that creates what we call bereavement overload. It's very difficult to deal with that type of bereavement. Or you lost your friend from home, you lost a colleague from work, you lost your neighbor at the same time. That can create bereavement overload. I've been seeing a lot of that. I saw a patient where she lost almost every member in the family, and she's the only person left. Family members died from COVID, and she had to bury one after the other, one after the other, and that just created a lot of bereavement for the patient. And sometimes bereavement overload can lead to depression, because you just don't know who to mourn, how to mourn, where to start, because it's just a lot of losses happening at the same time. The other condition that I've been dealing with a lot in our practice is complicated bereavement. Now, complicated bereavement is caused by a number of things. For example, most people were not allowed, or have not been able to bury their loved ones in our traditional normal ways of mourning people. So for example, when your loved one was sick in the hospital, you were not allowed to see them, to touch them, because of COVID. And when they died, there were limitations in terms of the contact with the body. And even the funerals that we have, they have to be brief, they have to be short, you have to be straight to the point. So a lot of people feel like they have not really had closure with their loved ones, and because of that, their bereavement is not normal, it's complicated. So a part of you feels like that person is still alive, because you've not really had the chance to have a closure with regard to the loss of that particular person. And the complicated bereavement can also lead to depression as well. And the other type of loss that I have been seeing lately, it's what I call non-losses, or what is referred to as non-losses. So this is when you've lost someone that people feel that you shouldn't really mourn that much for that person, or the mourning is not worth the kind of a person that you've lost. So for example, when an old person dies, people will normally say, well, he was old anyway, he was old anyway. But we fail to remember that relationships don't get old. People get old. The fact that my grandfather was 90 years old does not mean that my relationship with him was old, and therefore I should not mourn their loss. So non-losses happen again when people have had miscarriages. People will normally say, well, you will have another child, or at least the child was not born. So you have not really lost a human being. You just lost some medical carcasses. You don't have to worry much about that. So non-losses create depression in patients because they don't get enough support from the society, because the society is under the impression that it's not so much of a loss, it's a non-loss. And that is something that is quite common lately, because we've been losing quite a lot of old people, and a lot of patients have had to mourn their loved ones in terms of that. The last one that I'm noticing, which is always there, is relationship difficulties, marital problems. I guess because husbands and wives spend a lot of time together now, chances of conflicts are higher than before. We've been seeing, an increase in the now in terms of domestic violence, an increase in terms of abuse, an increase in terms of all types of abuse, emotional, verbal, physical abuse. We've been seeing an increase in terms of that, and also in terms of parents abusing the children. So that is something that is quite common lately in our practice. So these are the common psychological issues that we've been dealing with under lockdown, and I've shared some of the symptoms so that when you pick them up, and as a minister you feel like, I don't think I can handle this, or I don't think I can help the person, then you can refer either to social workers around you, to psychologists around you, to other counselors around you. And I also want to emphasize that as a counselor, you need to remember that it's not every person that you will be able to help, and it's not every situation that you will have a solution for it. And in actual fact, counseling is more about listening and creating a safe environment for people to share their struggles, as opposed to you giving them solutions. So I'm saying this because one of the temptations that new counselors fall into is a temptation of trying to help everyone, and the temptation of being everything to everyone. You need to have some boundaries. You need to have some limits in terms of the number of people you can see. You need to be able to say no as well, and say, look, what you're dealing with is not something that I have the skills to assist you with, and I think I should refer to someone who will assist you with that. Yeah, so that brings me to the end of my present. Let me hear from you guys if you have any questions, if there's any clarity that you need from what I said. Thank you.
Thank you very much, Ndate Mbhele, for a very, very powerful presentation that really helps us to realize how important to do the counseling during this difficult time, where everyone thinking that the only way is to touch people physically, to be there with them, and trying to assist on their situation. And also on your last tone, when you indicated that as a counselor, our job is to listen and to create a safe environment for the patient.
Yeah,
I
yeah.
really thank you very much on that note. I'm now gonna move to my colleagues and our students to give them the time now to engage and ask questions and comments. I will follow the same procedure by taking hands according to now. Yeah, this thing started again. Oh my goodness, anyone can hear me?
Yes, we can hear you.
Sure. I don't know what happened now.
I can hear you, Ralph.
I can also hear you.
No problem on our side.
But now, yes, I can talk, but I can't control my device because at the end of the day, I have to mute my mic and also check the hands so that I can give people a chance to talk. Now this thing, it went off again here. Prof, are you here? Or Dr. Shibalo, are you here?
Yes, I'm here. Yes.
Who is here? Dr.
I'm
Shibalo?
here. I'm here. Yes.
Can you help me there, Prof? Sure.
Sorry, I just had we just had a power outage for a few minutes, so so I didn't know, I couldn't hear what you were asking. Sorry.
I'm asking anyone to share now. The phone is my device is switched off the screen again. I can't control the screen. I have to restart my device again.
Oh.
Yeah, any one of you between you, Dr. Shibal and Prof, can assist me on leading the discussion that side.
Okay,
I have to now restart again.
Okay, I'll assist me. Okay, that's fine.
Okay, thank you very much. Let me try to switch it off because my mic is gonna disturb you now.
Okay, thanks.
Okay.
I can see Zanele's hand is up there. Zanele, can you come in?
Okay, thank you, Doctor, for your wonderful guidance. You really opened my eyes about little things that we often miss when we're dealing with our congregations. My question is the dangers of under-equipped counselors. Sometimes people will come to you because you are a spiritual leader and thinking that you know everything. And some people are so proud as that they don't set boundaries and say, yes, I understand you have a problem, but I'm under-equipped to assist you. So what are the dangers that you've noticed of under-equipped counselors? Because I know of a case whereby somebody was expected to give counseling to a suicidal person simply because of the position that person was in.
Yeah. Well, it can be quite dangerous because some of the problems that are presented to you as a spiritual counselor will require, medical interventions. Let's take, for example, someone who has what we call major depression disorder with suicidal thoughts. If you are not equipped to assist that person, because there comes a stage where they need to be admitted. There's nothing you can do. Talking will not assist them, and it's late for any type of conventional counseling to intervene. They will have to be admitted in the hospital, be put on a specific medication. So insisting on helping that kind of a person can lead to a situation where the person ends up committing suicide. So it's very important to know your limits, and it's okay to say, look, I'm not equipped. I mean, even me as a psychologist, there are conditions that I don't have experience in them, I don't have knowledge about them, and I just tell the patient, look, I know someone who specializes in that, and I think you should go to that person. You will benefit more. The most important thing to remember is that whatever we do as counselors should be in the best interest of the patient. It should not be about you, your image, and wanting to look like someone who's competent. It should be about, is it in the best interest of the patient? And sometimes it's in the best interest of the patient for you to refer them to someone else. And I think that humility is quite important.
Okay, second, I see Marco Matawate, my brother. Can you come in? Thank you. And let me say, let's take two hands. Brother Matawate, thereafter Twala, then you'll respond after the two. Person has spoken. Thank you.
Thank you, Program Director. Thank you, Dr. Mbhele. I hope you are fine where you are. My question is simple. Who counsels the counselors? You just mentioned that 80% of the things that were related to your work are bad news from other people. And now, how do you debrief, and how soon? Is this something that you get used to, that no, I'm doing counseling, I don't have a problem? How do you bridge the gap, like between now you starting home after having
So
Yeah.
having counseled people with various problems and so forth. I just want to know about that. Thank you very much.
No, that's a very good question. So there are two types of getting help as a counselor. So we have what we call peer supervision. So this is where you call another minister and say, look, I'm having this situation and I don't know how to deal with it. What do you think about it? So they're giving you advice, practical tips on how to go about it, and they're just giving you their input. So it's more pure supervision. It's not counseling per se. And then the second type of help you need as a counselor, it's where you become the patient. You go to another counselor who's more experienced than you, and you just sit there and cry about some of the things that you need to cry about. So it's important, especially when you start. They normally say the first 3 years of being a counselor, try to frequently go for supervision, because there will be a lot of cases that are quite difficult for you. Obviously, there comes a time when most of cases are not that complicated for you. You are able to deal with them, but it's important to have that peer supervision. You can form a group, as ministers, where you meet once in a while and you discuss your challenges as counselors, because if you don't talk about these things, they start affecting your lives. If you can check, most of psychiatrists, psychologists, pastors, ministers in churches, a lot of them have problems with substances. A lot of them have relationship problems, and the reason is because we take quite a lot, but we don't make time and space for us to get help, and we start getting affected by some of the issues that we're dealing with. So I don't know if it's answering your question. One, get your friends, your colleagues, the people on this group. You need to form a group where you guys meet and talk, but then have an individual session with someone who's a counselor, who's more experienced, where you can be the patient. Thank you.
Thank you.
Fala?
All right, thanks, Mbhele. I just want to ask something, boss. Fortunately, I don't know if should I say fortunately, but in one of my subjects that I was doing at honors level, we did advanced pastoral counseling. Now, there's something that I'm interested in. I want to further my studies in counseling, but there's something that I'm missing every time I'm attending a session with the sex. I just want to find out, in your clinical psychologist, what method or theories are you using?
Okay. In general, which theories am I using?
Yeah, which theories are you using in your, especially in a clinical psychology where you practice most?
Okay. Well, I was trained mainly from family systems theory, which is quite different from someone who was trained in UCT, for example. They're trained in what we call psychodynamic theory, and the difference between the two is that the one approach, as you know, it says the problem is within the individual, whereas with family systems theory, the problem is within the system, and what the individual is telling me is a symptom of structural and systemic dynamics within the system that the person comes from. So I was trained more in systems, and I work mostly from systems.
Okay, no, thanks.
Okay. I see, Zanele, your hand is still up.
Yeah, it's a new hand. Okay. Doctor, my question is that we are recording this Zoom session. Would you be comfortable if we share it in our seminaries, social media, YouTube?
I don't have a problem at all. I'm not a doctor, though. I forgot to correct that. I'm still a misty. I'm still working towards that. Yeah, but I don't have a problem. You can share it with other people.
Okay, and then my second question is that I understand that you spoke of bereavement overload. And I've read somewhere that people who encounter 3 traumatic experiences back to back, they tend to become suicidal. So does that mean, based on what you're saying, that a lot of people will now be more suicidal?
Yeah, that is my experience as well. A lot of people who are experiencing multiple losses, they tend to develop depression, which leads to suicide. But then there's a difference between, and this is where I think most of us get it confused. There's a difference between being suicidal and having a yearning for someone who has passed on, having a yearning to be with someone who has passed on. So when I'm suicidal, it's more about I want to end my life. I'm tired of life. But when I have a yearning, it's not so much that I'm tired of my life or I am not happy with my life, but it's more about I miss this person so much that I wish I could go to the other side of life just to spend time with him. So the preoccupation is with the deceased. Whereas with suicide, the preoccupation is with the termination of life. I just want to die so that I can be free from the challenges of life. I don't know if that distinction makes sense.
Yeah, it's very good. Thanks.
All right.
Okay.
Yes. Thank you. I'm back. Sorry. So we should refer you to Mr. Mbhele.
Yes, sir.
Okay, Mr. Mbhele, I don't know if my colleagues are going to be mad at me for asking this question or whether you will be able to answer as well. I think amongst us as a student in this institution, there are a lot of things that are not done correctly, and there is anger now amongst us as trainees. And in the next year or so, we will be going out there to counsel people. Would you say we need to take care of ourselves instead of in terms of getting counselors to deal with our anger management issues before we go to the field?
Let's talk about anger. What is anger? Because if, for example, I'm in an environment where things are not done in a particular way, or they're done in such a way that it provokes me, it doesn't mean that I have anger problems. You understand? A person who has anger problems, it's a person who deals with every challenge of life from a point of anger. And their anger is not in proportion to what they are dealing with. So, for example, I forgot to say happy birthday. You are so angry that you don't want anything to do with me. You are so angry that when we meet, you don't even want to greet me. Then I can say you're having anger problems. But it's quite common that students will have issues with the program. They will have issues with the logistical and administrative issues. It doesn't really mean that they have anger problems. But to answer a more general question, it is important for you as students to start going for counseling before you start working with people, because you cannot help people identify their blind spots when you don't know your own blind spots. So it's very important. And even if you can look at research, the most effective counselors are counselors who've dealt with their own personal issues. And I'm sure we all have personal issues that we need to deal with. So I think every one of you, my recommendation is that you need to see a counselor at least once before you start working as a minister or before you go into the field.
Okay. Okay. I see no hand, but I have a question myself.
Mm-hmm.
I do a lot of counseling, especially relationship counseling.
Yeah, yeah.
My training is I only have a certificate in marriage counseling, but I do a lot of readings to help myself,
Okay.
empower myself. Yes.
Yeah,
But
yeah.
I've realized that there are challenges, especially when you are counseling females when you're a man. I have realized that, and my approach now, I changed my approach to say whenever I'm doing face-to-face counseling, I make sure that I do it with another person from the church side, a lady. If the person is a lady, I do it with a lady from the church so that I can also be safe. What is your comment on that?
I think just clarify it a bit. What do you mean, just so that we can be safe? What has been the challenge?
You know, when you are counseling, say for instance, a female with a problem of relationship with
Yes,
maybe their
yes.
husband and so on. Sometimes
Yes.
when you're busy talking with this, you realize that the discussion start to change. It starts to change, to move you to where you don't want to go. So for me to be to be safe, I try by all means that I don't do it alone. I always do it with somebody. That's why I say, can you give us your experience in that field?
Yeah, no, that's good. That's good. Yeah, I think I had suggested this to Prof before, and I think going forward, this is something that needs to be done. It's very important that each and every person who's going to work with people, as far as counseling is concerned, must do a course on what we call transference and counter transference. Because if you don't understand those two concepts, it's going to be very easy to fall into the traps that patients are bringing into the session. It's very common that females, when they are in counseling sessions, especially when they start feeling safe and start feeling like you are understanding them and you showing them this compassion and empathy, it's common that they will have positive experience of the session, and in their minds they easily misinterpret that as having sexual or romantic feelings towards you as the counselor, which is what we call transference. So they are projecting their internalized emotional and psychological issues on you as the counselor. And if you are not able to handle the transferences in the counseling, you will find yourself in trouble. Getting a colleague to assist you is one way of doing it, but I think what is more sustainable is for counselors to be trained in terms of managing, because you will also have transferences. The patients will come to you and you just find them very attractive, or you just feel so comfortable around them, and you just start experiencing these emotions that you don't even know what's happening. And if you don't know what's happening on a psychological level, you can easily fall into the trap of having inappropriate relationships with patients. So I think my suggestion going forward is there should be a course in counseling of ministers where you deal with transference and counter transference. What you are talking about is what we call positive counter transference, where the patient feels emotions that are somehow romantic in nature, but it's not so much romance, or it's not so much attraction to you, and you will discover it later. Should you fall into a relationship with that patient, you will realize that it's not that they were attracted to you or they wanted to be with you. It's just that there was a positive experience in the session and they fell for it. So we should have a discussion around that. I will be happy to have a discussion just on that topic with people that are interested in it.
Oh, thank you very much. I think that's really helping us. Anyone who would like to ask a question? I see a hand from Zanele. Zanele, take your time. Thank you. Zanele, that's your time. You can talk. You can ask a question or a comment. Zanele?
Apologies, I'm on mute. Okay, yeah, thank you, Mr. Mbhele, for the illuminating answers that you were sharing with us. I somewhere I read that transference is actually, if you are successful in one area of life, like in high school, and then you go to college, but you still use the same methods that work in college, in high school, that is called transference. And the second question that I have is, as a counselor, how do you assess yourself that you are ready to counsel? Is there a checklist that you can test yourself against?
Okay, all right. Let me start with the second question. I think as a counselor, you grow with experience. And I don't think you can ever be 100% ready until you start working, But I think it's important to know the basics of counseling before you can start counseling. And I think that's how you should measure yourself. What are the basics of counseling? Listening, empathy, compassion, how rephrasing, asking questions, and dealing with difficult patients. Those are the basics. That's counseling 101. I think once you understand those basic concepts, in my opinion, you are ready to start learning, practicing counseling. But obviously, a lot of things you learn them on the job. A lot of things you learn them by experience. A lot of things you learn them as you keep reading and dealing with every case as if it's the only case you have. So when you're dealing with depression, you go all out, you read about depression, you find someone who specializes in depression, you ask them questions, you ask for their advice and all that. But I don't think you should be too hard on yourself and say, I need to wait until I know everything for me to start counseling people. Once you have the basics, I think you should be ready to go. But also it's important that you should have dealt with your own issues, or you should have knowledge of your own issues as a person. Know what triggers you, because those things will happen in the session. If you are triggered by people who challenge you, be aware of it, because you will have patients who challenge you. You will deal with arrogant patients who are belittling, who speak bad to you, and if you've not dealt with your blind spots, you can easily become ineffective in counseling. So I think those things are important. On the first question on transference, I think transference, it's a word that is used in different contexts, but in the context of psychology, especially within what we call psychodynamics, because that's where the concept of transference comes from. It's within the theory called psychodynamics. It refers more to, I'm having emotions inside of me, but I don't want to acknowledge them. So I'm feeling insecure, and I don't want to acknowledge my insecurity. So what I do subconsciously is that I make you feel insecure, and I want to convince you that you are the one who's insecure. So I'm transferring that which I'm afraid of dealing with, and I'm making it someone else's problem. So that is how we use the concept of transference in psychology and therapy.
Thank you very much.
Okay, I see Prof. Kritzinger. Prof. Kritzinger. It's your time. Prof. Kritzinger, it's your time. You can talk.
Prof, unmute.
Oh yeah, yes. Oh, are you back? so I can reverse.
Yes, I'm back.
Okay, I'm reversing.
No, don't reverse. Carry on, my brother.
I must reverse because I must be preparing for my next session.
Okay.
The next session is mine.
Okay, yeah, no, you can reverse, it's fine.
Thanks.
Prof, over to you. I can't see Prof. Christina now.
Yo, what happened?
Okay, colleagues, Gianni, is your old hands or
It's a new hand.
is a new hand?
Yes.
Okay, you can speak.
Mr. Mbhele, what are the ethics of recording a session electronically, because of the data could leak and the content will be sensitive? Would you recommend taking manual notes? Because sometimes in order to understand, you may need to give yourself homework and replay the session. What would you advise?
The first thing is to get consent from the patients. Before you can record the session, they need to give you consent. But I wouldn't advise that you record your sessions. Rather take notes, as you are engaging in the counseling session, because nowadays a lot can happen. People can easily access your recording, or you lose your laptop and someone finds it and they listen to the whole session. So, and also when you record a session, remember the new POPI Act. There's a lot of issues around it. Where are you going to save the session? Is it safe? You have to put it on a particular cloud. So it just makes your life a bit difficult. So I prefer to just take notes as I speak to the patient. I don't prefer to record the session, but there are times where, especially when I'm doing forensic cases, where I need to record it so that I can present the evidence in court. But then I always make sure that I get consent from the patient before I do that. And then once the session has been used, then I immediately delete the recording.
Okay, thank you very much. Prof, your hand is up again. Prof,
Thank you, Chair.
unmute, yes.
Thank you. We had a power outage. Every time the power goes off for a few minutes and then I have to get back. Thank you very much, Brother Mbhele. I want to know, maybe somebody has asked the question while I was out, but ministers who do counseling often tend to start using Bible verses rather quickly to counsel. There's a theological counselor, J. Adams, who speaks of nouthetic counseling. So it's you bring in the Bible and you admonish and you unmask and you expose and you call people to repentance. How do you deal with that? What advice do you have for us in that regard?
Yeah. Thanks, Prof, for that, because I think I did tell you the other day that we do a lot of damage control in counseling as psychologists from people who went through spiritual counseling. Let me make an example. I had a patient early last year who lost her sister, and she went to Umamfundisi, the pastor's wife, for counseling. She was crying hysterically. And the pastor's wife said to her, "You can't be crying like that. You are a child of God. And remember, the Bible says that I don't remember where the scripture is, but she quoted a scripture along the lines of when we mourn, we don't mourn like unbelievers or like heathens, something like that." And on top of the bereavement that the patient was dealing with, she left that session feeling guilty that I should not be feeling this way. I should not be mourning my sister like this. I'm not spiritual enough, or I'm not Christian enough. So it just created a lot of guilt feelings in her. So I think the use of scripture in counseling, it's something that if you properly and strategically use scripture, you will get better results. But there are times when people abuse scriptures, when people use scriptures to make you feel guilty, to judge you, to make you feel like you are weak or you are not spiritual enough. I think that kind of approach is not helpful. But there are a lot of materials within the Bible that can be used. For example, I said to the same patient, I said, "Well, I'm not a theologian, but if I remember well, Jesus cried when Lazarus died." And that for me tells me that crying and feeling pain when you've lost someone does not mean you don't trust God, and does not mean you are not a Christian. So I was using that scripture, but my aim was to deal with the guilt feeling and to normalize her pain, to say it's normal to cry and it's normal to feel pain when you've lost someone. So I'm not against the use of scripture. I think for me, it's the question that you need to ask yourself is, what am I using the scripture for? What am I trying to accomplish with the use of the scripture? What are my therapeutic goals? Because remember, in counseling, the aim is to create a space for a person to vent out, to create a space for a person to make sense of what is happening in their lives. And if you're using scriptures to fulfill those goals, I think it's a good thing. I think it's a beautiful thing.
Yeah, thank you very much again once more, and Mbhele. Colleagues, we are left with 15 minutes on our time for the comments and the questions before we break for the last session of the day. So is any one of you still have any question while you are still thinking about the questions? Mbhele,
Yes, in
there
that.
are situations that as a minister, you must be a father, you must be a teacher, you must be a preacher. You find that the counseling is not one of your strengths.
Yeah.
What can you advise to the future ministers in that line, more especially after we qualify to be marriage officers? So where we have to now come to deal the premarital counseling, and sometimes it's something that you didn't learn in depth in your theological training. So what can be your advice on this in this regard?
It's quite challenging. It's quite challenging. I think be honest with yourself as a minister, like we spoke about. Be aware of your limitations. If, for example, you're having the first couple for premarital counseling, it might be advisable to do the premarital counseling with another minister and learn from them in terms of how they do it. But reading is very important when you are a counselor. You know, develop yourself on topics that you are not equipped on, and consult with counselors on things that you don't understand on how to do things. But you do get people who just don't like counseling. You know, you get ministers who say, look, I don't want to do counseling, I want to preach. I can host meetings, but I don't want to be sitting and people crying. If you have that luxury to appoint someone as a counselor or to train one of your members as a counselor, good for you. But if you are in a situation where you are the only person who can do that, I think you need to go for counseling yourself, because a lot of times the avoidance to deal with people's problems, it's an indication that I'm not comfortable with my own emotional issues and I need to attend to that. I know people who have not really dealt with their emotional issues. They don't want to be in awkward situations where there's someone crying or where they're listening to someone's problem, because when they do that, it evokes a lot of suppressed emotions in them and it just makes them very uncomfortable. So my advice will be go for therapy. Learn from other ministers who are doing counseling, but read. You need to read a lot as a counselor. That will make you very effective in terms of your counseling.
Mbhele, thank you very much. One last question, maybe. Is someone can be charged for the life lost, maybe as a minister, like you indicated earlier about the woman who was crying, went to Bamfundisi seeking for the help. If such a person lost their life, and maybe for an example, she wrote something on the paper to say, after being engaged with Maketa, this is how I felt. So I don't see why I have to live anymore. Can be any consequences that we are facing as ministers trying to fit on the shoes of the counseling while we are not professional counselors?
I don't know how the legal system will deal with that, but I know that the ethical bodies, like for example, I'm registered with healthcare professional, HPCSA. I will be charged for that. You know, that you had a suicidal patient and you did not do the necessary due diligence, you know, because first of all, when someone is suicidal, call the ambulance, get the person admitted, they need to be medicated, and then we can do the counseling. But if a person is suicidal, you don't take a chance with that. And I know as psychologists we can be charged by the board, but I've had psychologists who were also charged in court. So I don't know how it will work with ministers, but I'm sure you have an ethical board that you are registered with. I think you might get into trouble for doing that, you know, because you knew that this person's life is in trouble. It's more like if I tell you now that I'm going to kill Prof after the session, and you had that information, you know about that, you are obliged to report me to the police station or to do something to try and protect that particular person. So if you see a suicidal person and you're not doing anything about it, or you're doing more damage to the person, I think it can easily get you into trouble.
We don't have a body. So if somebody was counseling a suicidal person and you know they are...
Yeah.
Hello?
I never see your hands.
Apologies.
Okay. Okay, Brother Gian.
Muruti, apologies.
No problem, you're welcome, my brother.
Yeah, but I think that maybe we will need guidance in terms of how to report.
Yeah,
because counseling is a sensitive thing, and we need like accountability.
Yeah. I agree with you. I think the issue of ethics should be added in terms of the training of ministers when it comes to counseling, because it can easily get you into serious trouble. So it's something that I will recommend as well to the committee.
Yeah, no, thank you very much for that idea. I think we have to really. I see another hand now. We are left with 9 minutes. Brother Focus.
Thank you, Chairperson. Mbhele, I just wanted to ask, because now I think pastoral counselors or pastoral therapists can also register with HPCSA. So my question is, how do you then cooperate or try to bring together your knowledge?
You break a lot on that, Focus. Can you repeat your question again?
Am I a little better now?
Yeah, but I can hear.
Okay, so I was just asking, how can we incorporate the knowledge that you have in terms of pastoral counseling or pastoral therapy, and then try to align it with psychology?
Yeah.
Because obviously there's other approaches within psychology, which is just the basics when it comes to the pastoral therapy.
Yes.
And
yes.
again, in terms of the narrative therapy, because I think one of the things that have now started to be well known is narrative therapy. So in terms of us telling our stories, because there are so many approaches that one can look into when it comes to narrative itself.
Yeah.
So, but my question in terms of that is, how is it? I mean, is it credited or is it well known? I mean, the approach of narrative therapy, is it well known?
Yeah,
or is
it's
it
well known.
credited when it comes to therapy itself? Thank you.
Yes, no, it's a well-known approach, and there's a lot of data on it that it's one of the most effective techniques in therapy. But I think to answer the first question on how do we incorporate information, I'm of the opinion that psychology and spiritual counseling need to have a relationship. There has to be a relationship between the two fields because they need each other. I think it's important that we have workshops for ministers, and it's also important that sometimes ministers should run workshops for psychologists, because some of the things that we're dealing with in our counseling, they really need spiritual counseling. And so it's important for us to share information and knowledge with regard to that. It's something that I've been recommending ever since I've known Prof, that I think it's important to call psychologists, psychiatrists to have some workshops on specific topics with ministers, because I mean it's not going to only protect the patients that you're dealing with, but it's going to protect you as well as a counselor.
Thank you.
Thank you, Brother Focus. Colleagues, I don't see Date Chibalo. I just thank you.
Sorry? I wanted to ask a question.
Okay, I thought maybe you're saying thank you.
No.
I see your hand, like 2 hands folding up there. Okay, you can ask the question.
Yes, my question was to say to the counselor, our counselor here, do you consider what we call cultural differences when you do counseling? Because to me, I have realized that cultural differences and the beliefs and unbeliefs, I think they have a great impact in the way these things happen. Can you help us in that?
Yeah. No, I think that is a very important question. When I was trained in masters, we did a course on African psychology and African epistemology. And the aim of that course was not only to teach us about the impact of culture in Africa, but also to make us aware of different cultures, and also how do you deal with the impact of culture within the context of counseling. I think that's another important module that we need to develop. as counselors, because culture is everything. When it comes to diagnosing people with schizophrenia, for example, you have to look at the culture. I've had patients who say, I'm seeing my grandmother inside a dam or inside a glass of water. And Western psychology will quickly say this person is hallucinating and they must be locked up in Stekfontein, be put on medication. But when you understand culture, you will understand that some of those things are quite common in other cultures and you need to respect them as opposed to trying to demonize them or making them a pathology. So the issue of culture is huge. It's huge. That is why today we have what we black psychologists or African psychologists, and their focus is to make sure that they're as culturally sensitive as possible to the African community, because we've made a lot of mistakes as psychologists by ignoring culture and by ignoring religion as well. So what you're raising is very, very important, and I think it's a discussion that can take the whole day, where we just talk about the importance of culture and understanding it in the context of therapy.
Thank you.
Yeah, colleagues, yeah, I think now we came to the end of our discussion with Mbhele. I don't know if Prof is still in the meeting, because earlier on he said he's going to join the GS meeting. He was invited there as a guest. Gianni, on the list, can you see Prof?
He has excused himself.
Okay, thank you very much. Colleagues, I think let me ask one student, Mr. T. Letsoa, to thank Mbhele on our behalf before we break for 5 minutes or 10 minutes tea time. Oh,
Thank you.
Another hand. I see a hand of Gianni before. Oh, sorry, Letsoa.
Yeah,
Brother Gianni.
If we need counseling with Mr. Mbhele, how do we get in contact with him?
I think personally, and Mbhele on his presentation, he will leave his contact details there.
Yeah.
And also on our chat group in Mbhele, there are about 2 to 3 students who are requesting us as management to make sure that we are having such a training, maybe intensively so with one-on-one or with a group of students before they can be licensed. So I think we're going to look on that concept, not concept per se, that direction. Maybe we are going to have more discussion with you, maybe to come to assist our students. I think we still have enough time to come to talk to you about the future counselors, more especially to incorporate on the ministry.
Yeah. That will be
I think that one.
Okay.
Okay.
Mbhele,
maybe last word before Ntate Letsoa.
Well, I think ke thabile haholo to be here, and the kind of questions that I'm getting from the ministers, it gives me a lot of hope. The kind of ministers that this institution is producing, they are quite open-minded and very academic as well, which I think for me it gives me hope or we can merge, or we can build a relationship between psychology and future ministers. So I'm really inspired. I don't want to lie, but thank you very much.
Thank you very much, Ntate Mbhele. Ntate Letsoa.
And Mbhele, thank you very much for your time and for the eye-opening session that we had with you. We are really happy, and I think most of our students and ministers present here, they've actually learned a lot, so that we just know our boundaries. I think for me, that was a highlight of the day. As ministers, we must know our limit. So thank you very much. We're looking forward to actually working with you in the future. Thank you very much, Ntate, on behalf of our students.
Thank you.
Thank you.
Thank you very much. Ntate Mbhele, only one last comment. One of our guests, it was Reverend Mabelani, the scribe of Southern Synod. he left the meeting because he said to me that he's going to attend another meeting at a certain hour. So he sent his apology, but above all, he said, thank you very much for your presentation.
Okay, no, ke a leboha. Thank you very much. Hey,
It's a pleasure.
thank you. Bye.
Thank you very much. Ntate Mbhele, if you want to be with us just to listen, you're also welcome. Ne?
Okay, no, can I session ka 2, so I would have loved to stay.
Okay.
Yeah, okay.
Okay. All the
Thank
best.
you.
Man.
All right, good.
Thank you. Colleagues, Muruti Chibalo and the students, let us break for only 10 minutes, colleagues, 18 minutes too. We can continue with the next topic if it's okay with you.
Yeah, it's fine.
Okay, thank you very much.